Welcome back to Pediatric General Examination. Today we talk about lymphatic examination. We have four major groups including head and neck, axillary, inguinal, and popliteal group. Starting with head and neck groups, divided into submental, submandibular, preauricular, postauricular group, occipital group, anterior cervical, posterior cervical group, and supraclavicular group. Start gentle palpation of anterior groups from the back. Start with the submental group, submandibular group. This is the preauricular group, the anterior cervical group, then posterior cervical group, and finally the supraclavicular group. The normal size of lymph node in this area less than 1 centimeter. Above this measurement considered abnormal, while more than 1.5 centimeter in the inguinal area considered abnormal. When you find an enlarged lymph node, you should pay attention to its consistency, fixation, tenderness, overlying redness, or any skin changes. Now from anteriorly palpate the posterior group, occipital group, and postauricular group. The axillary group divided into 5 groups. First, the pectoral or anterior group, which located in the anterior axillary fold, responsible for lymphatic drainage from the chest and chest wall. Second group, the subscapular or posterior group, palpable deep in the posterior axillary fold and drain from the arm and chest wall. The third group, the brachial or lateral lymphatic group, drain from the arm and palpable in the area proximal to the humerus. All these three groups drain in the central group, which palpable in the base of the axilla. The subclavicular or apical group represent the last lymphatic group before the lymphatic vessels drain to the venous system. The examiner starts by palpating the pectoral group behind the lateral aspect of the pectoralis major muscle. Afterward, palpating the central group, followed by posterior group in the area of posterior axillary fold. Then the brachial group of the upper arm. Distinguishing between the lymph node and surrounding muscle is best achieved when the arm is relaxed and lowered. The superficial inguinal group divided into horizontal and vertical group. The horizontal group located below the inguinal ligament and can palpated parallel to its course. This group responsible for draining of lymphatic fluid from the part of the external genitalia, trunk, and lower back. The vertical group located adjacent to greater saphenous vein and drain lymphatic fluid from lower extremity. Palpation of inguinal group best performed when the patient lying down. Finally, the popliteal groups palpated by slight flexion of the knee, by pushing up by middle 3 fingers and pushing down on the knee by the 2 thumbs. It's deep lymph nodes and rarely palpable.